Okay, hello, this is Dr. Ayub. Today, actually, I will start my lecture on highlights of female reproductive system ultrasonography. Okay, so I am not going in details about the anatomy, physiology, and others, but I will highlights or points out the important points that those are very important clinically and also important for the board exam. Okay, so in highlights of female reproductive system ultrasonography, you must need to know details about the anatomy and physiology, okay, and then you need to know the lab values that helps in diagnosing the female reproductive diseases. Then you need to know the other modalities used in female pelvic ultrasonography, and then you need to know the indication of GYN ultrasonography. Then we will talk about the pathologies. In pathology, there are classifications. You need to know the pathology of pelvic cavity, like pelvic inflammatory disease, then endometriosis, okay, this type of couple of diseases we need to know, and also pathology of the uterus in details, then pathology of the ovaries. Okay, so we're going to discuss all those things more or less details, but let's concentrate on the anatomy. Okay, so in anatomy, for the female, we need to understand the embryo. In anatomy, we will describe the embryology, or development of the female reproductive organs, because there are some congenital anomalies that happens to the female reproductive organs, and if you understand the embryogenesis of the female reproductive organs, so then it will help us to understand those pathology, and it will help us to diagnose sonographically those female reproductive organs. We'll know that, and then we will need to know the location of the female reproductive organs, and the female reproductive organs you know that external and internal. Okay, we will classify in that way. Then we need to know the sizes, size, shape. Okay, and we need to know the pelvic muscles. Pelvic muscles. Then we need to know the relationship. Relationship with the other organs. That is very important, okay? We need to know that, and these are very important, and and let's talk about the anatomy. So then we'll talk about the physiology. In physiology, mainly we will describe the functions of the uterus, function of the ovary, function of the cervix, functions of the vaginal canal, and the functions of the oviduct, that is fallopian tube, functions of the ovary, and two things we need to focus, that is the menstrual cycle and the ovulation cycle, okay, or ovarian cycle. We need to understand that what are the hormones those are responsible for this two functions, ovulation and menstrual cycle and the ovarian cycle. Those are the very important, because clinically it has very much impact on the hormonal influence, and if there is imbalances of this hormonal proportionality, so then other clinical features will develop. Okay, so that is very important. Okay, let's go on the anatomy first. Okay, so in the anatomy we like to see first what are the parts of the female reproductive organs, or parts of female reproductive organs. Okay, so if we go in that way, that external genitalia, and internal, I think GI, internal genitalia. External genitalia means that we can see from outside. What are the external genitalia? And internal genitalia, that we don't see from outside, we can see it through the ultrasound internally. Okay? The external genitalia, what are those? So, mons pubis, that is covered up by the pubic hair, and the whole thing of the external genitalia is known as vulva. Okay, I'll show you. Mons pubis, then labia majora, labia minora, then clitoris. Okay, so these are the external organ, and you can see the vaginal orifice, only the orifice. Vaginal orifice, externally we can see that. Okay, so now this part is known as vulva. Vulva. Okay, so now it has a little importance that we usually don't scan all those structures unless there is some indication. So example, there might be inguinal hernia, there might be femoral hernia, mostly the femoral hernia. That time we need to scan the labia part. Okay, and sometimes we scan the translabial ultrasonography. We do to see the lower segment of the female reproductive system. There is some indication when their transvaginal or internal examination, ultrasound examination is contraindicated. We can place that area, place the transducer on that area. Okay, so now if I draw the diagram of external genitalia, so it looks like that. Okay, so okay, this is mons pubis. Mons pubis, and you will see this is the outer fold. Okay, so this is labia majora. Majora means the major, the bigger labia. Labia means fold. And there would be labia minora. We call it labia minora. Minora means the minor, small one. Then you will see the opening of the urethra, and you will see the opening of the vagina. Okay, so, and this is clitoris. This is urethral opening orifice. This is vaginal orifice, vaginal orifice, and the anus is here. This is anus, and this distance from here to there is known as perineum. Okay, so we need to understand this vulva area, that is the external genitalia. Now, importance of knowing this, clinical importance. Clinical importance is that the femoral hernia can come through the labia majora. You can see the bulging, looks like a lymph node enlargement, looks like a abscess underneath, or some other lipoma or tumor, fibroma, whatever it is, but it could be a swelling through the labia majora. And that labia majora is an external layer, and it protects the underlying tissue and the labia minora, and they can be closed but still not tightly closing the orifice, urethral orifice of the vagina, but the labia minora or the inner fold, okay, they actually can close the vaginal orifice. And now at the junction of this labia area, there is a very sensitive tissue, projectile tissue, and it has a lot of nerve endings known as clitoris. Okay, and the opening posterior to the urethral orifice is vaginal orifice, and we can see that opening, and there will be another opening is here, so anus. So there are three openings. Urethral is anterior, vagina is middle, and the anus is posterior. Okay, and the anus goes with the rectum, the proximal part, okay, and this vaginal wall, posterior wall of the vagina, is nicely attached with the anterior wall of the rectum. Okay, so sonographically we can see that. Sonographically we can see, and also we can see that urethra is embedded on the anterior wall of the vagina. Anterior wall of the vagina. And urethra is only 4 centimeters long, and it is on the anterior wall of the vagina. That's why the retrograde movement of the germs can take place from the motion of the vagina, and the retrograde movement of the germs through the urethra can go into the bladder from the genital organs. So that's why in female the UTI, cystitis, is more common than man. Okay, so now there are two folds, one sensitive tissue and the three opening. Urethra is anterior, vagina is in the middle, anus is posterior. Okay, we need to remember that these three opening is close together, and problem in one opening, especially on the vaginal opening, a vaginal canal, it can causes obstruction to the urethra, it can causes obstruction to the rectum, and also the pathology of the rectum or even the hard mass can obstruct the vaginal canal. That's why during the labor if there is a heart feces in the rectum, so delivery of the fetus is troublesome, difficult. That's why they are given douches or enema to clean the rectum. Okay? And this area, the perineum, is very important area, because when we do the translabial exam or transperineal exam to see the lower uterine segments, that is from the isthmus cervical part, cervical opening, cervical canal, and the internal os and external os and vagina, we need to see for certain disease evaluation. Then we use the transperineal ultrasonography, because the transvaginal ultrasonography is contraindicated at that time. Okay, so this anatomical knowledge, we have to know this. Okay, we understood the two anatomical surfaces we can put the transducer. One is transperineal, another is translabial, and the three opening we need to take care. And the vaginal opening and canal is in the middle, and it is closely apposition with the urethra and also the rectum. Okay, so keep that in mind. Sometimes when the transvaginal examination is contraindicated, we can also see the female reproductive organs by inserting the probe or transducer through the rectum, and we can see the female reproductive organs, because those organs are so close together. That's why you need to know the anatomy very nicely, especially the anatomical relationship. Okay, so this is external genitalia. So now we will go over the anatomy of the internal genitalia. And before going to internal genitalia, I want to give you the idea about the embryogenesis or development of the female reproductive organs. Okay? The development of female reproductive organs. The female reproductive organs develops from the two paramesonephric duct, and its name also is Mullerian duct. Develop from the two paramesonephric duct. Two paramesonephric duct. This is known as Mullerian duct. Okay, make sure you know this, because they ask this question in the board. The male reproductive system develops from the Wolffian duct, and female reproductive system develops from Mullerian duct, and also known as paramesonephric duct. And these two paramesonephric duct, they appear parallelly. they appear parallel, and as the way you understood that para-mesonephric. Nephric means the kidney. Okay, the kidney in the third stage of development, it is in the pelvic from the 7 weeks or beginning of the 6th week. So there are 3 stages of kidney development: pronephros, mesonephros, and metanephros. From 6th week to 14 weeks. This time is needed for complete development of the functional kidney. And during the development of the kidney, so the mesonephric tubules are formed. And some of the mesonephric tubules are skipped. They are not taken by the kidney, but they form at the same time for the use of the development of the female reproductive system. And that is known as Mullerian duct or para-mesonephric duct. Para means by the side. And mesonephros is a developmental stage. Okay, these 2 Mullerian duct, they developed. Okay, and they are paired, they are close together, and they fuse together at the body. Okay, they fuse together and they form the uterine fundus and body, and they will, this part of the Mullerian duct will turn into fallopian tube, okay, so